Hi dear doctors, welcome to Kidscovery. I am Dr. Parv. I am your pediatric faculty and we are discussing pediatric immunology, and the topic of discussion for today is a very important topic. Okay, the name of the topic is Wiskott-Aldrich Syndrome. Now this never used to be such an important topic, but then it's a trend nowadays that this syndrome is being asked every now and then. So that's why it's an important topic as of now. So Wiskott-Aldrich syndrome, can you see this cutie child? Yeah. So can you see this cutie child? This child is having eczema. So eczema is actually the itching, okay, and scaly, itchy skin. Okay, so eczema is actually what? It's a scaly, itchy skin is going to be there. That's eczema. Okay. And then you have got petechial hemorrhages, like the red thing which you can see, that's a petechial hemorrhages. On when you will go to see for the platelet count is going to be decreased. There will be thrombocytopenia. So there will be platelet count which is decreased, and of course that's also one of the reason of petechial hemorrhages. That's also one of the reason for easy bruising. Okay, so just three things you have to remember, and this is the important thing. Okay, so easy bruising, or you can say even the rash is going to happen. Okay, so Wiskott-Aldrich syndrome is can be remembered. Wiskott-Aldrich syndrome can be remembered with a mnemonic that is called as PET. Okay, or you can remember RPET. Okay, RPET. So Petra or RPET, anyhow you can remember. So what is T? T for thrombocytopenia. What is P? P for petechia, E for eczema. Okay. Now coming on to the definition of Wiskott-Aldrich syndrome. So Wiskott-Aldrich syndrome is a X-linked recessive immunodeficiency. Okay, so very much similar to your X-linked A-gamma globulinemia. Okay, so A-gamma globulinemia, similarly Wiskott-Aldrich syndrome. Okay, so how we used to remember during our MBBS days is Wiskott-Aldrich syndrome protein. So remember, there is a gene which is called as WASP gene. Okay, WASP gene, that is Wiskott-Aldrich syndrome protein gene. So if it is mutated, it leads to the Wiskott-Aldrich syndrome. And we used to remember here WASP is not a good thing. Okay, so it should be recessive. Okay, so see, one WASP came. So X-linked recessive. Okay, so X-linked recessive. Okay, it should not come X, it should be recessive. Okay, so this is how we used to remember. So the gene protein is WASP gene, X-linked recessive is going to be there, and the mnemonic to remember, a classical triad, the mnemonic is water. So what is water? W for Wiskott-Aldrich, A for there is atopic eczema with increase in IgE. What do you mean by atopic? Atopic is actually type 1 hypersensitivity reaction, or you can say it's a sort of allergy. It's sort of what? It is a sort of allergy. So atopic eczema, I told you, dry, scaly, itchy skin with increase in IgE because it's a allergy. T for thrombocytopenia, E for eczema, and R for recurrent infections. So actually this is the proper triad. So if you want to add this in PET-R, you can add like P for petechial hemorrhages, E for eczema, T for thrombocytopenia. R, I told you, can be rash also, but R is actually the recurrent infection. This is the most important hint. So this water mnemonic is extremely important. Just don't forget it, because this TER is actually the triad. Okay, TER is actually the triad. So they ask you which is not the part of the triad. So rash is not the part of the triad, whereas thrombocytopenia, eczema, recurrent infections, they are the part of triad. Now it is going to show you thrombocytopenia. Platelets are actually less, like typically 20,000 to 50,000 platelets, but then microthrombocytopenia, because the size of the platelets are also very low. They are very small platelets. Okay, so that leads to petechiae, that leads to purpura, I've already told you. And any procedure you do, like for example, after circumcision, it is done in Muslim people. After the umbilical stump is going to get cut off from the body, then also it's going to bleed like anything. Okay, so these are the clinical hints which are suggestive of thrombocytopenia. Okay, so fall from the umbilical stump and from the after the circumcision, that's going to show you a lot of bleeding. Okay, so this is not it. So see, the Wiskott-Aldrich syndrome, I always teach like this: W and M are the mirror images. W for Wiskott-Aldrich syndrome and M for malignancy. So Wiskott-Aldrich syndrome is related to the malignancy. Which malignancies? Very simple. One is going to be B cell lymphoma, other is going to be leukemia in the adulthood. So once the child is going to grow, it is going to have B cell lymphoma and leukemia. Okay, very simple to understand. L for lymphoma, L for leukemia. Okay, and which lymphoma? B cell lymphoma is going to be there. Okay. Coming on to immunological defect. Now the problem is in immunology also. Okay, so there is an impaired antibody response to the polysaccharide antigen. So Wiskott-Aldrich syndrome is itself a immunodeficiency also. That's why you were seeing a recurrent bacterial infections. Do you remember I told you that PET R or water, the R is recurrent bacterial infections. Why? Because the antibodies are not getting generated in response to the polysaccharide antigens. That's why there is poor response to even the polysaccharide vaccines. Okay, so you give some polysaccharide vaccines, like for example pneumococcal vaccine, pneumococcal polysaccharide vaccine, PPV, and the child is not going to generate the antibodies, and once the actual infection of pneumococcus is going to come to attack the body, no immunity found, and that's why the infections are going to be very much severe. Okay, and that is why, my dear friends, this bacteria, the encapsulated bacteria, encapsulated bacteria, actually the concept is that encapsulated bacteria have got capsule which is actually made up of polysaccharide. Okay, which is made up of polysaccharide. But what happens in Wiskott-Aldrich syndrome is, okay, you remember Wiskott-Aldrich syndrome protein. So what is P? You can remember AS is absent, P for polysaccharide. Okay, so there is no antibody which are going to be formed against the polysaccharides, and that's why the encapsulated organisms like Streptococcus pneumoniae is going to be there, like Neisseria meningitidis, Haemophilus influenza. We don't have any immunity against them. That's why the child is going to show a very high chances of recurrent bacterial infections. Okay, so what is going to be there when you will see the immunological profile? See, IgG is normal, IgM is also normal, IgE is elevated, and IgA is elevated. Why IgE and IgA are elevated? Because if you remember, we have got a hypersensitivity reaction also. You remember there is eczema also which is going to happen. That's why IgA, IgE are increased. And of course, in order to see the VASP gene, you have to do flow cytometry. Because, so very simple, this is a screening test. The screening test is going to be flow cytometric. Now, what is the definitive treatment? So, HLA matched hematopoietic stem cell transplantation. You have to transplant the hematopoietic stem cells. Okay, you got it. So, you have to give the hematopoietic stem cells so that a normal or a good amount of your thrombocytes thrombocytes are formed and they can function properly. What are the supportive treatments? So remember, IVIG, IV immunoglobulins have to be given, okay, for gamma globulinemia. Then pneumocystis jirovecii is a very serious disease which happens in Wiskott-Aldrich syndrome. So this is actually important. Okay, Wiskott-Aldrich syndrome has got pneumocystis jirovecii infections, and that's why you give what? You give the cotrimoxazole. Okay, you give what? You give the cotrimoxazole in this patient. Okay, trimethoprim sulfadoxine is the full form, trimethoprim sulfadoxine for pneumocystis jirovecii in the Wiskott-Aldrich syndrome. Okay, and I always teach you like this. This P is responsible for remembrance of Wiskott-Aldrich syndrome. Okay, and splenectomy, yes, splenectomy has to be done because it can resolve the thrombocytopenia. Because if the platelets are getting formed but they are not formed properly, so this spleen is responsible for their destruction. So if we destruct the spleen, if we kill the spleen, there will be no more destruction and thrombocytopenia can be taken care of. Rituximab is something which is a monoclonal antibody. I hope you are well aware from your pediatric knowledge that MAB, that is monoclonal antibody, is effective against for the autoimmune cytopenias associated with VAS. So, there are different mechanisms in Wiskott-Aldrich syndrome which causes the killing of platelets. Okay, so that's why what we can give the rituximab in order to at least prevent the autoimmune mediated killing. Okay, so prevent what? Prevent the autoimmune mediated killing of your of your platelets. Okay, so actually this is the end of Wiskott-Aldrich syndrome. Please don't forget what is the triad. We have given you a beautiful mnemonic called as water. So this is important for you to remember, and thank you so much. And please comment down in the comment section if you have some good feedbacks, and make sure that you drink water and stay hydrated. Thank you.